Welcome to this edition of TAC Tic Talk. Jaclyn and I caught up with Dr. Adam Del Torto. Dr. Del Torto is famous for educating chiropractors around the world on the endo-nasal balloon-assisted cranial adjusting, which he writes about in the December issue on page 34 of the American Chiropractor magazine. He even has a nice photo there on the front. It's not the whole cover, but right on the front right side. And here we are, joined with Dr. Del Torto today. Dr. Del Torto, nice to have you. Welcome, Dr. Adam Del Torto, on TAC Tic Talk. People may not recognize you from the cover picture that we have. We had you on the front cover of the most recent December issue of the American Chiropractor. You're in a suit, looking pretty dapper. And of course, we were
I think
referring
it's a smaller
to the
picture, right, Dr. Joe? It's a smaller picture.
It is. It's not the full, but
I was on the cover and I missed it.
No, you're on it. So we're talking about the cranial facial release technique that you have patented, right? And that's why this goal here is so important in describing what you do. That you have, but you were in a suit, so like people don't realize that you also dress down. And this is like a relaxed environment here. So welcome.
I was much older in that picture, so they may not recognize me.
Well, I hear the balloon assisted adjusting technique actually reverses time. So that's
Absolutely.
what we're,
adding years to my life. Absolutely.
Well, welcome. So Dr. Del Torto, can you talk a little bit about, your background and what kind of influences had helped you develop this technique and bring forth these kinds of innovations in the treatment of these types of disorders of the head?
Right. Well, I'm a 1984 graduate of New York Chiropractic College. And back then, New York Chiropractic College was absolutely the best chiropractic school on the planet. We had the most amazing philosophical background with Dr. Frank DiGiacomo. We were forced to take like 13 different techniques as a core curriculum. They weren't options for us. They weren't what do they call alternative classes. It was our core curriculum. And so I had a very strong philosophical background coming out of chiropractic school. Right out of chiropractic school, I started attending Parker seminars, is where I think I probably met you and JR for the first time. And
sure,
they, how Parker, they have like 15 different seminars going on at the same time. And I used to sit front row center for all the greats, for Jim Parker, for Sid Williams, Reggie Gold, Jim Zigafus, Fred Barge, Charlie Ward. And I would sit in the front row. And I swear to God, they were talking only to me. I mean, everything they said, I wrote down. I found all my notes from this was back in 1984, I think was my first Parker seminar. And they just inspired me to such a high level that I caught fire. I mean, I am so passionate about chiropractic, which, not to get off on a tangent, but that's how we started Chiropractic Rocks. But while attending one of those Parker seminars, they were teaching cranial adjusting upstairs. I'm like, oh, wow, I want to know cranial, so I go up and of course I was late. And the only spot they had open was the front row right in front of the instructor. And he started talking about putting balloons up people's noses and inflating them. And I'm like, are you insane? I mean, I literally got up and walked out of the seminar and I could feel the guy's laser pointer in the middle of my back going, there goes a guy who just doesn't get it.
Oh my gosh, this is really hilarious.
He was the godfather of cranial ballooning, Dr. Richard Stober, and I walked out on him.
Oh, no.
So that's how I first got introduced to cranial ballooning.
That's amazing.
And, that's a common, I think, response initially when you're looking at this stuff. You're like, "Are you guys crazy? Are you guys,
Talk about a total 180 though. To go from walking out on the first time you ever heard of this to now you're like the torchbearer of this technique in the industry. And I wanted to make sure too. I'm just jumping in, Dr. Joe. This is Jaclyn. You remember meeting me too?
Yeah.
At these shows all the years.
I remember meeting the whole family.
I know. Well, so, I mean, believe me, all of us from when we first heard about this balloon assisted adjustment, we've all been amazed as well. Now, I wanted to make sure too, if you can tell us the difference. You've got the technique, but what is the difference? What is Chiropractic Rocks itself? Is this specifically about the technique?
Oh no, Chiropractic Rocks is a completely different thing. This is like it's a annual convention we have every year. Last year we had, I think, 24 speakers. There was 40 vendors. Probably, I mean, it's only our third year, so we only had like 220 attendees, but it's growing exponentially. It's catching fire. I mean, our whole intention is to help shape the future of chiropractic and create the next generation of chiropractic legends. So that's our mantra, based on all the philosophical influence I had at Parker and going through New York Chiropractic College. It's basically just pure raw chiropractic is what it is.
Mm-hmm. Well, I love that. And you rattled off like, 10 legends, right, that you'd been listening to. It's like, it's hard to define who those people would be today. Right now you've got all these practice coaches and whatnot, but those kinds of legends from the 80s that you're referring to, I mean, they're so iconic in that era. But it seems like there's it's lost its way a bit. That's why I feel so enthusiastic about your mission with the Chiropractic Rocks, and really you can feel the energy that you're bringing to that whole effort. But I am interested in the technique, so that's why. But we'll follow that up in a second.
Let's talk about that.
Yeah. Right. So, Jaclyn, did you have any other comment on that?
Well, no, I just wanted to make sure to delineate that from the get-go, is that, when we're talking with Dr. Adam Del Torto, there's two major movements that you're involved with. Who knew, this Chiropractic Rocks symposium that you're putting on now, you mentioned your years behind you, but also balloon-assisted adjusting technique, which is, we've heard stories about it when our sister Tracy was at a Parker show and she got it done.
Tracy is the toughest warrior I've ever met. I mean, she laid down for that. It was probably one of the most difficult balloonings I've ever had. I mean, I don't know what she's got going on in her skull, but this rarely happens. But she got a nosebleed that lasted for like 2 days, and that hardly ever happens. Yeah. But she had a smile on her face.
Major car accident when she was younger, so she's probably got a lot up there that you just broke loose.
Yeah, she took it like a warrior, and I swear to God, she kept that smile on her face going, "Hey, it's not you, it's me," the whole time. And I'm like, oh my gosh, I was ready to donate blood, because she was bleeding for like 2 days. But she is an amazing lady, and just, I have the utmost respect for her for actually allowing me to do that.
Well, it was the best story ever. It's one of the best trade show Parker seminar stories ever, where she got this adjustment and then she's walking around afterwards with a Kleenex to help with any of which, like you said, it doesn't happen very often, but Tracy always liked to be a little bit memorable, Adam. So I just wanted to let you know that's her MO.
She is ingrained in my heart forever. Trust me. I just love her to death. Every time I see her, I give her a big hug, and she's got such radiance. Her energy is so contagious. I love her. I love your whole family. Everything about, the Busch family, that you guys have just perpetuated chiropractic for what your father started American Chiropractor magazine. Is that correct?
So it's 45 years ago this year.
Yeah, generations. I mean, generations of chiropractic that you have carried forward, and made a difference, really, because a lot of the articles in your magazine are directed at chiropractic, not all these other adjuncts, and I really respect that about the magazine.
Mm-hmm. Well, we like more who walked. Dr. Joe went away and he came back.
Dr. Del Torto, can you tell us a bit more about cases that you can expect to treat with this type of therapy? I mean, you mentioned doing that on Tracy, so that's an adult, but what about kids or neurodegenerative condition?
Well, I mean, first of all, I didn't invent this technique. It's been around since the early 1900s, and it was originally used primarily for kids with learning disorders. The pioneer was Dr. Richard Stober, and he specialized primarily in kids, Down syndrome children. And he would raise their cognitive level of just learning ability to such a high level that people would come from all over the world with their Down syndrome children to be treated by Dr. Stover. And there's one guy in particular, his name is David Jones, and he's got his own website called nasalspecific.com, where he dedicated his whole life to informing the world about this technique because of the difference that it made in his life. So he was treating kids with like aphasia, learning disorders like delayed speech, delayed reading, and basically just elevating their cognitive levels to such a high level that they went on to just develop normally. I mean, the primary thing that it does is optimize brain function. To understand how this technique works, you have to realize that the skull is not one solid bone. It's made up of 22 individual bones that actually move every time you breathe, or at least they're supposed to. But if you have inflations of the skull due to head trauma, birth trauma, uneven bite force due to like TMJ disorder or missing teeth or malocclusion, anything that will cause a disruption in this dynamic skull, this motion of the skull, it causes fixations of the cranial bones, which causes impediment of cerebral spinal fluid throughout that part of the brain. And so there's studies that have been done even back as far as in the 1930s. A.D. Speransky he's like considered the father of modern medicine. He's like the MD's version of BJ. And he did studies back in the 30s where he would do nothing more but put mechanical pressure on the control centers of the brain. And he was able to identify over 80 specific diseases that he could consistently reproduce over and over by doing nothing more than putting mechanical pressure on the control centers of the brain. And I mean, these studies were so important that BJ dedicated 15 pages of the green books specifically to A.D. Speransky and his research, which is where BJ came up with the whole phrase from above down, inside out. That above down portion came from the research done by A.D. Speransky and the influence that he had on B.J. Palmer.
Well, listening to your story there about the elevating the intelligence or IQ of Down syndrome patients, I mean, without a doubt, that opportunity, you cannot ignore it, no matter what method one applies it. And it reminds me of an interview that we recently did with a representative from Logan College that has a master's in integrated pediatrics via chiropractic approach, right? And they're talking about adjusting the bones of the skull. And so, without a doubt, this is playing a role in these types of cases, autism, brain development issues that we need to pay attention to, as well as even potentially neurodegenerative conditions later in life. So now,
absolutely, you just nailed it with that. You nailed it with that.
So do you attribute some of this, do you see a difference with kids, the vaginal birth versus C-section, or I don't know how involved you get with patients that are children, and what kind of, do you have any studies, or has there been any kind of, follow-up with these cases? What kind of data could you hold on to and help to share that?
Yeah, no, absolutely. I mean, vaginal birth, first of all, is very important because it initiates that initial cranial compression, which initiates what they call cranial rhythmic impulse into the cranial system. But as the baby corkscrews through the birth canal in a counterclockwise fashion, the first thing that exits the birth canal is the left frontal bone. So any distortion of the birth canal as a result of any kind of pelvic subluxation, as we call it in chiropractic, that distorts the birth canal has a direct effect on the baby's cranium, and it's actually mirrored on the baby's cranium once they're born. So the most common cranial distortion we see is what we call an internal or inferior left frontal bone, where and you can I see it. It's probably like an epidemic throughout our society, where you have that eye that's a little, the eyebrow is a little lower, the eyes a little more almond shaped on that side. And these are the kids that have the delayed learning and the delayed speech. So we do a lot of work with newborns, with children with plagiocephaly, where their skull is not formed. And we do have before and after videos. We actually have a video where we show the morphing of the skull as it goes from having like a flat head to where we create a perfectly round skull within probably about a 6-week period. So, I mean, that is, of course, one of the primary things it does. But, I mean, most of the patients that come into us are for breathing disorders, because they don't know about any of this other stuff. They don't know about the cranial bones moving, and that by mobilizing the cranial system, you optimize brain function. Most people are coming in because they think it corrects breathing disorders, which it does almost 100% of the time, in the way of like deviated septums, sleep apnea, snoring, sinus conditions, all of these things. And we've got so many studies, before and after x-rays, before and after MRI, of occluded breathing passageways, and then the septum being corrected right down the middle before and after the balloon. So, I mean, the thing is that chiropractic works. We know that. That's why we're here. And chiropractors get 80% of their patients well by adjusting 20% of the nervous system. I mean, when you tap into that other 80%, I hesitate to use the word, but it's almost biblical, the level of healing that we witness in the office every day. It's literally miracle chiropractic. So it's
okay. So I'm going to
jump in. I want to jump in, Jaclyn. Come on. The water's fine.
The thing is, I first of all never heard about the Down syndrome thing. You've got my attention now, because I'm so concerned about all of these neurological disabilities that our children are being born with or evolving through. Dr. Joe, great question about the vaginal birth. I didn't know that one either. Of course, I'm the non-doctor on the call here, but as a mother as well. And I wanted to find out then too, because how hard or how easy is it then for like any chiropractor to apply this and learn it? Because it sounds to me like something that they would normally be going through surgical procedures when you're talking about reshaping the head. This is to me amazing. And so when we were talking about children with all these learning disabilities, how easy or how hard it is, Adam, for a chiropractor to learn your program. And, what's the gradient scale, the time frame? How much time do they have to put in to become a good one? You know what I mean?
Yeah, well, I'm not the only one out there teaching this. I mean, there's probably about 5 different versions of this technique. And I had no intention of ever teaching it. I was actually just minding my own business, adjusting spines, cracking skulls. And one of my patients was the executive producer of the E channel. And she was like, yeah, you do that weird balloon thing. She's like, yeah, we want to do a TV show on it. I was like, oh, cool. So I thought it was just going to air in and around LA, but it went global, and the first call I got was from South Africa, from a patient wanting to know where they could get it done. And then the second call was from Australia, from a doctor wanting to know where they could learn it. So that kind of gave me the motivation to start teaching it. And my version of it is a full body technique. It's not just balloons. I mean, we clear everything below the occiput before we even address the cranium using SOT protocols. So we actually start with the coccyx, because the coccyx is the loved brother to the sphenoid, which is the primary cranial bone that we're targeting. And then we move up the spine, clear everything below the occiput, take the torque off the dura. Then we do the balloon technique using my approach, which is different than anyone else's. And then we do a whole gamut of post-inflation cranial adjusting afterwards. So to answer your question, I teach it in 3-day seminars. They're 3-day, 18-hour seminars. And I just finished one in Miami this past weekend. We limit the number of attendees because it's such one-on-one hands-on training. And I want to make sure that when you leave there Sunday afternoon, you're able to go back to your office first thing Monday morning and initiate the technique on the first patient that walks in the door. So they're 3-day seminars, 18 hours.
So now, are you teaching SOT as well, or just the technique? I mean, because the technique, it sounds like, involves SOT. So
It's basic SOT. We're not there to teach them SOT. We just teach them the basic SOT procedures that we use in the technique. So,
so it's a 3-day technique.
Yes, but not. Yeah, 3-day seminar. We do touch on SOT. Everyone's on blocks when they get ballooned with my technique. So they're either blocked, to traction out the sacrum to put maximal tension on the dura, or they're blocked in a proprioceptive type of blocking procedure, which is category 2, so that the body knows where it is in space when we balloon them. But we're primarily focusing on teaching them how to insert the balloons and inflate them, and in what order, and how to determine the most appropriate opening to inflate. So that takes 3 days. But once you take one of our seminars, you can take as many as you want after that for free. So most people take like 2 or 3 seminars, the same seminar, before they really have a grasp on it. But after just one, you'll be able to go home on Monday and initiate the treatment first thing Monday morning.
I can imagine. I mean, Jaclyn, so every time you breathe, your head is moving and all these bones are, interplaying. And I guess one of the ideas is that it's going to unlock the whole sphenoidal axis, or how would you is that an accurate representation, Adam, of what's going on?
Yeah, no, I mean that you are very knowledgeable in this without even having delved into it. It's primarily targeting the spheno-basilar junction, which is the articulation between the sphenoid bone and the occiput. It's a symphysis joint. It's a disc-like joint, and it's all cranial motion revolves around that particular joint, that the spheno-basilar junction.
Yeah, it makes so much sense when you look at it mechanically, that it's hard to forget once you hear it. You're like, holy smokes. I mean, just so if it's like, and clearly your experience has been very favorable to the point that you wanted to develop the technique further and even begin teaching it. So, I mean, that in and of itself is a huge endorsement. I'm sure, you're not going to waste your time on something that isn't worth it. So
that's where I wanted to jump into and ask then, okay, now I'm thinking of how this can be applied. Okay. I'm blown away about the learning disability, disorders. You'd mentioned even deviated septums. Now I'm starting to think, does this mean, what does that mean for migraines, sinus? Obviously I'm thinking it's going to have a positive impact. Like you said, biblical, right? It's got to be all of the above. Check, check, check.
Yeah. I mean, I'm still blown away every time I come across a case that I think is unhelpable, because it's usually last resort patients that have tried everything else first. I mean, the thing that got me reintroduced to the technique was an article that came across my desk about a lady who had fallen off a horse and hit her head and had post-concussion syndrome, went to every neurologist, every specialist on the planet, and nothing worked she got minimal results, and then went up to this guy in Washington and got ballooned and basically just gave her life back. So, I mean, it's usually last resort patients with things exactly like what you've talked about: vertigo, migraines, trigeminal neuralgia, Bell's palsy, post-concussion syndrome, post-stroke, seizures. Patients like I have a kid coming over later today who was scheduled for surgery, for cranial surgery, and they canceled it because we started doing balloons on this kid, and all of a sudden his seizures have stopped. And they were going to go in and do this crazy, put plates in his head and all this just invasive type of surgery. And, it's all you got to do is reinstate normal function into the cranium, and the body's amazing. The body can heal itself if you just get out of the way, just remove the interference and then get out of the way and let it do what it does.
Well, and you'd mentioned something to me too. You said at the very beginning also that a lot of them will find you because of respiratory issues, like breathing disorders. I remember during COVID, I mean, I don't know if we can say we're out of COVID ever. They'll ever let that one go. But I remember Tariq Faridi telling me how fabulous this was for patients with COVID, with post-COVID. Do you have any kind of experience with that?
Oh, absolutely. I mean, one of the biggest, my practice just spiked after COVID because people developed this loss of their sense of smell and taste. and then they would come into us and we would start ballooning them. I mean, we do other things. We also, do laser therapy and other things along with it, but the primary treatment is the balloons, and they would regain their sense of taste, regain their sense of smell. I mean, that's almost a no-brainer. During COVID, where everybody was shutting down their practices and going out of business, my practice doubled. So
that's and that's where the issue was, right? The central nervous system, the brain, and meninges. So that makes sense. I mean, and that's another testament to the technique that people are thinking only chemically versus the functional aspect of what what can happen up here north of the spine. I find it very interesting. Right. So well, do you do hands-on adjusting with the rest of the spine? I mean, the SOT is mostly very passive from my understanding, right?
Well, I bastardize SOT. Sorry, Major DeJarnette. He's probably turning over in his grave right now.
That's a category 3 there.
Yeah, well, he's probably just going to curse me after that one. But I mean, I am a diversified chiropractic adjuster. Gonstead technique has saved my life so many times. I can't even tell you. I mean, I thought my career was over more than once, like two separate times in my life where I got injured, and my saving grace was Gonstead technique. So it is my go-to technique for almost everything. But I also do a lot of SOT. I use blocks on everyone. And, especially with this technique, when we're targeting dural torque and meningeal torque, the primary thing we're trying to do is reinstate normal cranial function and get that cerebral spinal fluid flowing throughout the brain and spinal cord. So that involves a lot of SOT procedures targeting the dura. So that's how we started incorporating SOT protocols into the technique.
Amazing.
No, that makes total sense. I mean, it's, absolutely. I think it's a phenomenal idea for anyone who's looking to broaden their application of innovative treatments and technique. And that's what this issue was about, the December issue, because you get into those ruts and you're like, all right, I know how to do that pretty well, but what else can I do, right? So, but this is definitely something that people should look into, especially if they want to solve those hard to treat cases that maybe, they've had no luck with, or even to help those youngins as they come around, right?
And Dr. Joe, that's what I was going to say is I don't think we have the luxury of saying if you want to. Honestly, from what I'm seeing and what I'm hearing is that there's so many children on the spectrum nowadays that if you're not, you really got to be ahead of the curve, and you got to make sure, because if you don't address that in your clinic in the most natural, healthy way possible, God forbid, we know what's going to happen to these kids and their families, and it's not good. So we've got to make sure that we're taking that responsibility upon ourselves. And so, Adam, I really applaud you for evolving and developing this. I know that we had it kind of scheduled for about 30 minutes. I didn't know if we just hit that 30-minute mark, if you wanted to keep going on and elaborating, but I wanted to make sure to let you guys know. You guys are awesome. This is really I had no idea how far reaching this technique was, and that your chiropractic rocks is. How often does the chiropractic rocks? Is it once a year?
Yeah, it's once a year. Like I said, we've only had it 3 years. The first year that we had it, we had such an all-star lineup of speakers. People were coming up to me going, how did you attract this level of legendary speaker to your event? And we only had probably less than 100 attendees, which was, just such a sin. But the array of speakers that we had on stage are going to be the future legends of chiropractic. And so now it's kind of gotten a little bit of a attention. I mean, it's gaining momentum. Now everybody wants to be on stage for us. I kind of modeled, or not modeled it, but my inspiration was Billy DeMoss with his Cal Jam. I love Billy. Billy's such a unique individual. And the thing about him is that guy catches fire. And when you catch fire, people love to watch you burn. And he's one of those people that I just gravitate toward. And, I got inspired to create my own version of an annual convention. Billy has got, he's got a lot of passion about, anti-vax and a lot of other things. And so what we were trying to do is more go toward the pro chiropractic approach instead of anti anything. We're just everything pro chiropractic and just trying to carry the torch forward to the next generation of chiropractors who didn't have the opportunity to meet the legends of chiropractic like I did. And I didn't even realize that how blessed I was to be in their presence at that time. I took it for granted, but that they were the connection to the earlier legends like the BJ Palmer era, and they were the bridge to the new era, which was me. Now someone's got to be the bridge to the next millennium of chiropractic, and that's what Chiropractic Rocks is all about.
That's the thing, Adam. You almost feel like you have a responsibility, right? That you have to kind of pass it on, right? So that it doesn't like just, shut down. I can understand that totally.
Well, that's what we always say. That's what we're doing as a magazine. We're a family of chiropractors for chiropractors. We like to work with doctors who have skin in the game, who are in the trenches with all the other doctors out there. So
is that written down somewhere? We're a family of chiropractors for chiropractors, because that needs to be right on your front cover. That is just a great mantra to follow. Right. I love that.
Yeah, that's
look, we developed it right here.
We're in it, right, Adam? So, and I think Billy, what he's doing, I mean, I think you guys are complementary. It has to, someone like that has to be out there, really raising the questions, but it's a different conversation than I think what you're doing. And so, they complement each other nice. And it sounds like it's growing as well. Yeah, so we're looking for that next year.
I was at the first Trail Jam when it was only like 100 people in a high school cafeteria. We were sitting around these white round tables that the kids ate lunch at, and then I saw it evolve into 3,500 people in an amphitheater. And, Billy can really deliver the message, and he comes from the heart. And, that he just has genuine passion for chiropractic. And so he inspired me to start this Chiropractic Rocks. I don't know what's going on with Cal Jam. It's been 2 or 3 years now since he's had it, and I haven't heard of another one being scheduled yet, but we're going to pick up the slack and help carry the torch forward with Chiropractic Rocks. And we want American Chiropractor Magazine needs to be there too. So we have a booth especially for you.
We'll probably get Tracy out there. She wants a follow up.
Well, I gotta figure out, Adam, now what are some upcoming technique seminars that you'll be doing? I mean, in between now and then, next year, I imagine it'll be early 2020 or late 2023 when you're doing your Chiropractic Rock seminar again. Now, what about your technique seminars as we're closing out 2022? Yeah.
So just Monday, what is today? Wednesday, Monday, I got home from being 7 months on the road. I'm talking every single weekend for the past 7 months. And I just moved up here to beautiful North Idaho. I haven't even moved into my house yet. So I'm going to take a little bit of a sabbatical, but our next CFR seminar is scheduled for April 1st in Burbank. Then we're going to do it a couple weeks after that in, I think it's April 21st in Spokane. And then we're going to Anchorage, Alaska in July. And so those are the next 3 that we have scheduled. April 1st, April 21st, and then July 14th, I think, in Anchorage, Alaska, which would be a good one if you've never seen Alaska, because it's right before the Red Salmon Run, which was done on purpose. And we could go up there, do the seminar, and then just go explore Alaska. So those are the only 3 we have scheduled.
Well, make sure you keep sending us the dates so we can carry them in future issues. People can definitely fly out there and enjoy the scenery and learn some great methods that they can apply.
Do we have the dates of the next Chiropractic Rocks yet? Do we have that one on the schedule?
Chiropractic Rocks right now is tentatively scheduled for the weekend of June 11th through 13th. I'm still negotiating with the Marriott.
What city will that be in?
Sorry, Burbank, California.
Burbank, okay.
That's our annual place.
So I remember to do that in June every year. So we'll make sure to keep following that as well. Yeah, we got nothing but love for you, man. We love what you're doing. So keep it up.
Thank you. It's mutual admiration. Love you guys. Thank you very much for having me on.